Others prefer home health, hospice, which is caring for those that are dying, clinics. And so I had this big, I don't know why, it wasn't hard for me to decide what I was going to talk about. I was asking Teresa, what should I wear? Should I wear scrubs or should I dress up? Should I wear scrubs or should I dress up? And that's kind of the nice thing about nursing as far as the career opportunities is you can become a nurse. That Bachelor's of Science in Nursing at BSN, that gets you that education. You go and take a state certified test, which is really serious business. You don't want to have to take that more than once because it's painful to begin with. And at that point, you pick where you want to go, okay? You start off working on a med-surg unit and you get some experience, but maybe you want to be a pediatric nurse and work with kids, or maybe you want to care for the dying. So you have many options. You could even be a nurse and never have much contact with people. There's insurance companies. You could work for an insurance company and do medical records audits, okay? There's so many opportunities as a nurse. So that BSN gets you that you're a novice, you're a beginner nurse, and then you go from there and decide, what do I want to do? You can change. I was in long-term care, I went to dialysis. Then as a dialysis nurse, I would put in needles in patients that look like this. So you need to tell me when we have about 15 minutes.
Okay.
Because I feel like she's the one, the problem child, isn't she? So this stuff right here, I'll pass it around. This is Gore-Tex graft material. If we can't put if we can't take a blood vessel from a patient and make it into a good, hearty access for the patient for dialysis, does anybody know what dialysis is? Okay, dialysis is when the kidneys don't work, okay? So what your kidneys are doing 24 hours a day, 7 days a week, these people come into a clinic 3 times a week for 4 hours at a time. You think sitting there for an hour, listening to me for an hour is tough? They sit there for 4 hours, and they could either have this, which is considered a temporary access into their chest that goes directly into their heart. They could have this that we access, hook up, or we can put these 2 big needles in that are, when I forgot my nail. So these are pretty much equivalent to nails, like that you pound into whatever you're building. And what happens is that blood is taken out of the body, goes through a machine, through this artificial kidney, which is called a dialyzer, okay? A dialyzer. And the blood goes through these little fibers, and then the dialysate, or their bath, goes through and it pulls all the toxins and all the extra fluid out that your kidneys are doing right now, okay? So removes toxins and removes fluid. So I'll pass these around so you can see. And so for 4 hours, most of the patients sit there, watch TV, read a book, sleep, whatever, and we clean their blood. And then they leave. Now, how many of you love your water, your soda, okay? We tell a patient that when they come to their treatment, so they either dialyze Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. They can only drink about 1 to 1.5 of these, or they should drink only about 1 to 1.5 of these between their treatments, okay? Everything that is liquid at room temperature is considered liquid. So a popsicle, pudding, Jell-O, that they're restricted. And not only are they restricted on fluid, but they're restricted on their foods as well, okay? Because that dialysis is what's keeping them alive. Their kidneys are not doing anything, okay? And the other thing several patients do, but when they're on the machine, when they actually become a dialysis patient, they don't go to the bathroom anymore. They don't urinate or pee anymore. So think about not going to the bathroom. You can't drink very much. You have to watch your diet. You have to show up 3 times a week. You have to sit there, and then let's throw in some big old needles, and off you go, okay? I'll show you the needle. That's what the needles look like. I won't pass them around. trust you, I'm just not going. Okay, so we put these in, and so this graft, if we can't develop a good vein for them, then the surgeon will go in and do this, and we'll stick that, but it's under their skin. Okay, so as the dialysis nurse, I do assessments. I will put the needles in, we'll hook them up, we'll do all of that. Sometimes removing all that fluid can cause their blood pressures to drop, at which point we'll give them oxygen. We'll monitor their O2 sats, okay, and their pulse. And I brought this so that we can pass this around, and if you just turn it on, you can see what your pulse is and what your oxygenation, what you're floating at there, and that's a pulse oximeter, okay?
So are a lot of these patients on the waiting list for transplants then, or what?
There are several have chosen not to do that because there's a whole lot of anti-rejection meds, a lot of different things, and they don't really know. I've had patients that have done the workup to get a transplant, and then they end up having a heart attack and they're worse off. So, I mean, it's really about, I've had younger people. I had a nursing student who was on dialysis for about 1.5 years until she got her transplant, and then she just graduated from a nursing school here in town. I ran into one of my dialysis patients when I first started in dialysis in 1999. My son was 6 months old. Graham, yes. The patient, not Graham, the patient was my age. I walked in to work, and here's this guy that says who was my age. And believe it or not, I was like in my 20s then. And he and his dad were sitting side by side. And unfortunately, they had, it was a hereditary thing where they had polycystic kidney disease. So if you think about it, and I have this here, and it's not Dora or Power Rangers or anything. It's actually pictures of the kidney. So you'll see where the kidney is in the body. You'll see what a healthy kidney, a diseased kidney, what it looks like. So the words are up here, and then just look at the pictures. So go ahead and pass that around. All right. So I'm back to, I keep kind of going off, but as a nurse, then in my dialysis time, I was a charge nurse. I staffed. Again, while you can do so many different areas as a nurse, even one place, your opportunities are endless. So I went from a staff nurse to a nurse manager, and at that point, a good friend of mine who was also a coworker, we were kind of on the same level, she decided to make a change. She went back to school to become a nurse practitioner. So she finished her schooling as a nurse practitioner, which then was 2 years. Now if you want to become a nurse practitioner, it's a doctorate program, so it's probably an extra year. She decided that I needed to make a change. Well, I wasn't happy with her because just because she was ready for a life change didn't mean I was ready. But I also had this really awesome job that fell into my hands, and that was the nurse educator piece at Nebraska Methodist College. So I had worked with dialysis patients. I even for a year-ish worked with pre-end-stage renal patients. So I took care of patients that their kidneys were kind of on the edge and try to stabilize them and keep them where they were at so they didn't have to start dialysis. So then I got this great job, but guess what that job meant? I had to go back to school. You know what school is like, right? Worst years of Teresa's life so far, she says, okay? I had to go back to school. It was an online program through Nebraska Methodist College, and I am not a nurse practitioner.